everyone. This is Maimah Karmo. I'm the president and founder of the Tigerlily Foundation. I am beyond thrilled to have a dear friend with me today, Representative Debbie Wasserman-Schultz, and Tori Guide, who's a patient and a survivor, a thriver, and a warrior. Debbie, thanks for joining us today.
My pleasure. So great to be with you, Maimah, and all of Tigerlily's members and friends.
Yes, thank you. You're a huge advocate for breast cancer patients. You're also yourself a survivor of breast cancer, and as you know, we're all reeling from this COVID pandemic, and trying to help patients get through this whole process of, learning how to deal with the trauma and disconnectivity around COVID, and then get access to screening and clinical trials. And so we wanted to chat with you to kind of just talk about what we're doing, what you're doing, and how we can all work together to help patients during COVID to get access to what they need.
Absolutely. And, I'll spend a few minutes because I'm not sure, usually we have the people in front of us and we can see everyone, and I certainly could scroll over and see all the people who've joined us, but I'm gonna spend a few minutes not only sharing my story briefly, but just talk about the work that I'm doing in Congress as an advocate on behalf of breast cancer survivors, previvors, people who are going through breast cancer right now, and of course our metavivors as well. So we need to make sure that we cover the breadth of the experience of people, women especially, who are or have dealt with breast cancer. So let's start with you, Maimah. You are an absolute inspiration. You become a dear friend. We've been in this fight really together since the first day that I shared my experience with breast cancer publicly. The creation of Tigerlily as a platform and as a place of comfort for young women who are dealt the blow when they hear the words "you have cancer" was such an important need. And you were one of the key people that helped me really identify the void that I wanted to try to utilize to help fill, because that was my goal once I came through my own experience successfully. And so I'm just going to talk for a few minutes, and then, however you want to proceed with questions or feedback from folks is fantastic. We are dealing with a once-in-a-century event with COVID-19, and while we are all sheltering in place, staying at home, keeping safe, making sure that we can stop and slow and eventually stop the spread of the virus is so critical. These are opportunities now that we have to educate one another and to reach out, because, when you are going through, the main thing that I know I experienced, as much as I was surrounded by people that loved me, and as much as I was fully immersed in my work when I went through my breast cancer experience, it is still an incredibly isolating experience. Now, layer on top of that, someone who is going through breast cancer now with the COVID-19 crisis engulfing us. There are challenges to being able to begin treatment. I know I've heard a number of stories since this crisis began of women who have actually had to put off some of their procedures because of the pandemic and the reduction in the amount of healthcare services that are occurring, some things being deemed elective as opposed to absolutely necessary surgery. So that's been a challenge. And then also, if you're already feeling isolated as a breast cancer patient, add on top of that we are actually all isolated for real, and it can really magnify what people are experiencing. So coming together now in this way is so incredibly important. So a number of you may have heard my story. I'll just go through it briefly. I heard the words "you have cancer" about 12 and a half years ago now. I was 41 years old. One day I was the picture of health. The next day I found a lump in my breast doing a routine self-exam in the shower. And a few days later, I heard the words, "you have cancer." I also, because I'm an Ashkenazi Jewish woman, a Jewish woman of Eastern Europe, be sent a bracket recommended to me because you when I had, because I, because I had a lump of breast and was a lot of cancer in my family, but not necessarily breast cancer. I had the test turned out to be BRCA2 positive. That made me 5 and gave me a 40 to 85% risk. So after discussing with my doctors and my husband for someone without the BRCA gene mutation, and that was so that I wouldn't have to walk on eggshells for the rest of my life waiting for the other shoe to drop. And I had a oophorectomy, having my ovaries removed, so I could remove the issue of dealing with ovarian cancer potentially. And I didn't share. I went through my experience privately. I mean, imagine as a member of Congress dealing with breast cancer treatment for 15 months and doing that, trying to do that without sharing it or sharing it with as few people as possible. My children were very young. My twins at the time were 8 years old, and my youngest daughter was 4. And so cancer being an incredibly scary thing for anyone, but certainly for children, and children associating cancer with death, particularly young children. I wanted to make sure, I knew I was going to be okay and I was going to come through the other side, but I wanted to make sure that I did before I sat down and shared it with them. And then there was the issue of being a public person and everything in my life really being very open and public. I didn't want my name to suddenly be, when I was quoted in a newspaper or referenced at all publicly, Debbie Wasserman-Schultz, who's currently battling breast cancer, because you are and want to remain more than your cancer. Cancer is all consuming, and so having it be attached to me in that way as part of my identity was certainly not something that I was interested in doing. So I was surrounded, thankfully, by my mom and 3 close girlfriends and just the right amount of staff to make sure that I could do my job full time and not miss a beat, and then be able to get to my surgery appointments and my checks and all the things that were associated with that 15 months of hell. And I only had 2 colleagues that I shared my experience with. A very close friend, former Congressman Ron Klein, who helped make sure when I couldn't carry anything more than 10 pounds after my surgeries, that he helped me, and we made sure we coordinated getting on the same flight to come home. And my then roommate, former Congresswoman Melissa Bean. So you need some people around you that you can trust and that will have your back, and they certainly did, and they remain dear friends today. I mean, I had experiences like when I had my expanders in. Of course, they have metal, and I had to leave keep a folded note from my doctor in my purse with me because I had to possibly go through the metal detector. Or I did have to go through the metal detector, and if it went off because of the expanders, I had to have that letter with me. And so you can imagine that keeping this under wraps was a little bit of a challenge for me. Another funny story. 9 days after I had my double mastectomy, I had a previously scheduled fundraiser that I was hosting for then and now Speaker Nancy Pelosi, and I was determined to make sure that we could still hold that fundraiser. So we, in order to continue to keep this quiet, a staff member who's a dear friend helped get me a mission bag that I wore across my chest, and we hid my pain pack that was attached to my chest wall in the purse. And Maimah's heard the story a million times. And she took fishing wire, and we made sure that we could wrap it in black hosiery so that when it stuck through the zipper, the closed zipper, that couldn't be seen. And then I had staff sort of I'm a hugger, so when people would try to greet me, someone would step in between me and the person, and that hug would turn into a handshake. So I mean, the bottom line is I tell this story because there is no right way to navigate cancer. We all are entitled to be able to manage it the way we choose to. Not everyone is able to manage it the way they choose to, because depending on your socioeconomic status, depending on on your familial situation, your how close by people are to help you. It can be even more challenging for some. We also, and Maimah, I'm not sure in the Q&A if you want to cover the early act and some of the other things that we're working on now, but we can get into the early act maybe in the questions. And
Yep.
we do have the early act that is law now that we're very proud of. Maimah was a big part of making that happen, as were so many breast cancer advocacy groups, but focusing on young women and the fact that we were left out and continue to struggle to be recognized as being an important group in the breast cancer community to address our unique concerns and situations that arise because of our relative youth is critical. And then lastly, I'll just touch on that I'm also working on survivorship legislation, because as I continue to use my platform to try to fill voids, there has not really ever been any comprehensive approach to helping women, but more broadly, cancer survivors deal with survivorship. Thankfully, we've had advances where people are living with cancer, and they are living as survivors for much longer periods of time. And if you were diagnosed young, as many of us were, I hope to, from 41 years old into my 80s or beyond, I will have lived with and there are challenges along the way, and the fact that you are always a survivor. I look at myself every single day. There's not a day, as confident as I am that I'm going to be fine, there is not a day that goes by that I don't think, I have my living proof staring me in the mirror when I get dressed every morning. It's not a day that goes by that I don't think about it. There's not a day that goes by that I don't have a tickle of a worry about a little pain here or there, or some odd thing that's happening that as a result of my implants or whatever, questions that I have to ask my doctor just because some new news item pops onto the screen. The decision about whether to stop taking tamoxifen or not once I reach 10 years of that prescription being part of my medication regimen. So I'm really thrilled to be here with your members and other interested folks, Maimah, and thank you so much for your work.
Thank you for being on. I really appreciate it. And I love you for so many reasons, but I love how you're so authentic and just sharing your story. I was preparing for this webinar, and I had notes and notes. I always prep, we always plan ahead. And then just hearing you share where you were.
I
know, exactly. I have a whole notepad. I have like 3 pads. And then I thought, I'm putting my notes down because it's really about sisters talking about what we're dealing with, right?
Exactly.
To your point about, to your point about being diagnosed, working with you on the early act was so beautiful. I remember you and I sitting in your office with Toby and Danny, and Noelle was like 4, I think, 3 or 4, trashing your office and answering the phone. And looking at how where that started and where we are now, but going through COVID, thinking about how afraid we were, and we have those same fears around recurrence and around access to treatment and so forth, and staying alive and healthy. There's so many patients now who feel disconnected because of COVID, who need clarity around access to screening. People who are getting mobile screening coming in that no longer can get mobile mammography.
Right.
Women who are metastatic. Tori will talk at some point about her experience, who they've halted clinical trials. Because of that, they can't get life-saving access to these different treatments and now or in the future. So people who could benefit from drugs that may be passed in a year or 2 or would have been passed or met FDA approval may not be able to have those kinds of drugs because of the clinical trials being halted. Patients who are in rural areas, there are no buses or transportation to get to different screening sites. And so, one of the things that we've been doing with Tigerlily is, me, I'm laser focused on my mission. I'm always looking at, we're not stopping. So our mission's like laser focused. We've been working with advocates, really, first of all, listening to what their needs are. We don't want to act without listening first. Like when you and I met, we talked and we listened. We talked a lot before even beginning to draft the early act and move forward. And so we've been doing a lot of listening of our patients, hosting webinars, asking them, what do you need? as a patient who's early stage, who's afraid to go to get screened? What do you do? Where can you find a hospital center that is safe enough for you to go and get screening without worrying about getting COVID? I have so many friends who are patients who are metastatic like Tori who are in treatment and are having different challenges because the trials are being halted, or there's just different issues around how do we get patients trials at home. So those are all being worked out at this time, but until then, there's a lot of disparity around care for patients who are facing disparities. Already like women who are color, who currently have a 40% higher death rate. There's issues around oral parity, patients who are now being told, okay, you can still continue your treatment, but you'll have your oral chemo first. But because they're at home, they're being charged higher prices. So there's things that were a challenge before, but this COVID situation elevated this to a different level. So Tigerlily's, really surging to meet the connectivity, the hugs, the hand holding, having people close to you through these programs that we're offering through our Pure Cat initiative. We're offering about 14 programs around Zumba, dancing, yoga, and so forth, and training. And then we're talking with our patients as well who are metastatic and who are experiencing trial issues with how to get real life support as you're facing a life-threatening disease. So I let Tori touch on a little bit on her experience being an MBC patient. She's in treatment right now. I sent her a text last night. She's like, I just got home. I feel like crap. I just finished treatment. But I want you to share, Tori, what you're dealing with.
But you look awesome,
gorgeous, by the way.
Thank you.
Fantastic.
Yeah, wigs and makeup.
Can you share where you are? Your journey?
Yeah, so I had chemo yesterday, and I just had to switch to a new medication. I think I've been living with metastatic breast cancer since 2016. I was diagnosed the week of my 30th birthday. So I was really young, dealing with a life-threatening illness that I really had no idea about. I didn't know when I was diagnosed that you could still die of breast cancer. I didn't know that women my age got breast cancer, let alone terminal breast cancer. That was nowhere on my radar. My grandmother had breast cancer back in the 90s. Unfortunately, she passed away in 2014, about 2 years before I was diagnosed. So it was just more of a shock to me than anything. My grandmother was the only person I knew at the time, other than my cousin, who was my second cousin, that had breast cancer in my family. So BRCA or anything like that, it just wasn't even on my radar. I had no idea what I was going into. Right now, I actually am on my 10th line of treatment with metastatic breast cancer. I am hormone positive and HER2 negative. So we've been primarily doing the endocrine therapies from the beginning. We did find out that I have a mutation called the ESR1 mutation, which makes me resistant to endocrine therapy going forward. So currently I am on chemotherapy. I unfortunately about a month ago found out during the beginning of everything COVID that I had progression with my cancer and that my treatment was going to have to change. And before that, my intention was completely going into a clinical trial. That had been the conversation with my oncologist of, this is what's next in line. This is the plan. When I progressed on what at the time I was on a medication called Doxil, when I was done with that medication, we were really looking at going into a clinical trial because there were some great things that I really fit into and that would, based on the data, would really benefit me. And we got to the point where I had progression, and the clinical trials that we had all been looking at all had suspended enrollment because of COVID. And it's not necessarily the people that were already in the trial. They were still being served. But for new patients that were having progression and needed to go into the trial, there was no access to get into these trials, that they were suspended enrollment. So for me, it was very disheartening because, obviously with metastatic disease, you're counting up in treatments, you're not counting down. So and when a medication fails, the idea is that there would hopefully be something in the pipeline. And when you have these things that are in the toolbox, in the pipeline that you're looking forward to, and now you don't have access to this, your question really is, am I going to survive this? is this going to be a conversation of, is there something I can go to, or am I going to be starting hospice? And at 34,
Sorry, can I ask you a question?
Sure.
What do you want to see done? Because, you know, I'm a woman of action, as is Debbie. And,
Sure.
you know, that's why we listen so much. So this has just been so hard. It hurts me, you know. I have so many friends like yourself who are metastatic. I lost my dear sister to MS a month ago. I said goodbye to her on the phone via FaceTime because I couldn't be with her because of COVID.
Yeah.
And friends like you I love, and Christine and Julia and, you know, Jersey and so many others, Shantae, that are metastatic patients. It hurts me that you could experience some things because of delay in access to trials.
Mm-hmm.
So, you know, we're talking about this now. People are going to be watching this all over the world. What do you want to see happen that can change to ensure that patients who need to get enrolled can get enrolled at some point? Like if we close our eyes and manifest a change today, what could be changed systemically to make that happen?
So, selfishly, I always like to see things be open for enrollment because that's where I'm at as a patient. And that's where I see a lot of patients at, is that we need these clinical trials. And we need to know that as a metastatic patient, if I progress, I have something that I can go to that's in the pipeline, because not having a medication means hospice. I mean, that's the reality of this disease. When you lose options in treatment, you will die of this disease. So, you know, obviously I'd love to see enrollment back open, but I think even beyond that, looking at a feasibility study, looking at what we've learned from COVID, when we close down these trials, how many patients are actually being affected? I really haven't seen any good studies as far as what the impact of this actually has been and what the potential for patients that have been shut out of having clinical trials due to COVID actually looks like. So I'd actually
Tori, can I ask you?
Sure.
I wanted to ask you a quick question. Are they closing down the access to the trials because they're worried that COVID patients might complicate it?
So I think it's a combination of a few things. I think one of this is, you know, when the academic centers have closed, a lot of this research is being done at academic centers. And are we going to have postgrad or grad fellows who are in the centers that can actually conduct the research? I think that's one thing that we have to look at. Another is PPE and the shortage that we're, you know, experiencing right now. Do we have the PPE available that if a patient needs to enroll and participate, that we can do this responsibly and in the best interest of the patient for their health? I think there's just a lot of factors that are going into it, which really makes sense from the outside. But when you're in the midst of it and you're thinking what's next and you don't have a what's next, I think all there is anxiety and questions. So
Tori, what about telemedicine and bringing trials into people's homes? I've been reading a lot about remote clinical trials and, you know, for the monitoring, medication, getting drugs into the house. What are your thoughts about implementing those kind of strategies to ensure that patients who can get enrolled and get access to trials?
I think with oral medications, that's really possible. But I really think that there is a disconnect for people that use IV medication for their cancer, and even what the community setting looks like, because I live in a rural area and in my county, I don't have a hospital that I can go to that anyone can even access my port. So for me to even get my port accessed, it's a 40-minute drive into a hospital, into a larger city. So it really becomes issues.
And
as
the
far
cost,
as,
it costs you
yeah,
how much per treatment? The cost to get there?
Yeah.
It's like what, $60 to drive back and forth?
Yeah, my round trip mileage right now to my nearest cancer center is a little less than $60 round trip. And with the medication I'm on right now, I am doing weekly treatments. Prior to COVID, I was doing palliative care appointments in Columbus as well. So you got to think, you know, is somebody really going to be able to afford, you know, over $200 just in mileage in a month? That's before you even enter the cancer center and pay one dime on a copay or for a medication or anything. So I really think that oral parity is going to be crucial going forward to getting these clinical trials into people's homes for these oral medications. And going forward, once they're out of the trial, I'm a big proponent for oral parity. My first medications were all oral medications. And the problem with how these drugs are right now is that instead of being billed as chemotherapy, which for Medicare patients like myself is billed under part of Medicare, these drugs are being billed under prescription plans. So you might go from having, full medical coverage that covers chemotherapy, but now this drug is being administered in a different way and it's no longer being covered. And it might go back to like an 80-20 or a different plan depending on what your prescriptions look like. And it just makes the cost exorbitant and unaffordable. I mean, I have one medication I was on that was $13,000 a month out of pocket, and I was not insured. And luckily, my cancer center had a drug assistance program. Not everybody is lucky enough to be able to get onto these programs. And
Right.
what are we doing on the insurance side? And, how are we making these accessible for people? Because we all know at the end
And
of
the
the day,
patients who are of color, right? Women who are of color, is like who are of color living in cities that have a high risk of women getting breast cancer, who are Black women and have the 40% higher death rate. Many women they can't afford $40 to transport back and forth to treatment.
right.
There are not some people who have lost their jobs. So we're trying to launch a relief fund for patients right now to give them financial assistance because, $60 is a lot for transportation and it's a lot for meals, right? If you don't have a job or your husband lost his job and he's your caregiver while you're in treatment. One of my friends, Nani Reese, she has brain mets and she's going through a lot also in Aurora area as well with her treatment. Her husband and she had treatment, I think it was week before last, and he couldn't be with her because of COVID. So they're facing the heart issues, they're facing the mental health and the trauma and stress, and the practical issues around financial toxicity around COVID and cancer. So I think those things are really important. A lot of patients, need to have paid leave, while they're on, so that's important as well. Can you talk about that, Tori?
Yeah, so when I was diagnosed, I ended up going on long-term disability through my employer, and I applied for Social Security disability. However, that means that you have 6 months with no paycheck. And for me being 30 years old, out on my own for the first time, out of my house, in being a single person, I didn't have an extra income coming in to my home. It was just me. So looking at some of these things like, how am I going to pay a water bill? How am I going to pay my rent? It just wasn't going to happen if nobody has 6 months of salary in the bank at your entry-level job. Like, that's just not something that happens. So
Maimah.
Hi, Debbie.
No, I just wanted to interject in the particularly in the CARES Act that was that was designed to provide assistance during the pandemic crisis. We do have 14 days of paid sick leave and up to 3 months of COVID-related paid family and medical leave. So, for example, if you're unable to get your normal access to your medication and the treatments that you're getting, you should definitely look into. I mean, I'm not sure who your employer is, but there are ways for you to take leave, be paid, and be able to concentrate, and others, not just you. So that there is that paid family leave as well as paid sick leave, even if your job doesn't offer paid sick leave.
Oh, that's wonderful.
I think one of my questions to you, Representative, and this is something that I don't know if this is addressing, is those people who are off for and receiving that medical leave. I think that's fantastic. But is there any stipulation that their benefits through their employer would continue? Because I know one of the things was when I was diagnosed, I made $3 a month too much to get Medicaid in my state, which left me uninsured for up to 2 years, before I could get access to my Medicare. Mm-hmm. So I really think that that's something that when you walk into your treatment center, I might have the money to pay the rent, but I might not have the money to pay the doctor because my insurance is gone.
Yeah. Well, these are all really excellent points.
Yeah, that's why we.
I know we're running.
Yeah, we have. No, I understand. We have been fighting to reopen the open enrollment period during this time, and the president, as you probably saw, has refused to do that, unfortunately.
Yeah, unfortunately, yeah.
I wish we had more time. This is a great conversation. I wish we had like an hour of time. I just love chatting with you, Debbie and Tori. I wanted to go into some things, so I want to continue this conversation. Debbie, we're having more of these via like tons of Facebook Lives, Twitter chats, and other engagements. So I'll reach out about having other chats, but
please do.
I want to go into what we're doing. I love seeing your face and getting your input and talking with you about different things. But Tigerlily is really, really active right now with these conversations. Talking about things is really important to elevate patients' voices, to discuss what's working, what's not working. Patients have real needs, like we're talking about access to trials, financial issues, access to oral parity, opening open enrollment, and so forth. We're working to meet all those needs while we're working to support their psychosocial needs, which, as you know, is very important. So as we're stuck at home or staying at home, how do we live our lives while we're living through COVID? And so, having that connection, that human touch is so important that I can't hold you, but I can say that I'm here through the computer screen, touching people through these different, like just dancing and knowing we're still alive and we're still here and thriving. And even if we're not thriving, we're still here right now and together, loving each other through COVID. So we're doing stuff through our Pure Cat initiative. We're collaborating with other partners like Sisters Network to do programming for women who are metastatic, who are facing that higher % death rate because of the lack of access to screening, clinical trial enrollment, access to care, financial issues, and so forth. We're looking at opening a COVID relief fund. People are just losing their homes, their jobs, and they shouldn't have to choose between eating and paying their mortgage or getting treatment. This should not be a choice. It's not going to happen on my watch. So we're looking to get funding to support patients financially through our relief fund, and then looking at how to make systemic change through policy to help patients have access sooner and faster to clinical trials. Julia Maues wrote into the message group, the chat group, that getting drugs orally is important, which it does work, it's happening. But some of the drugs most drugs are not available through pill form. So even though we can get drugs through the oral form, many are not available through pills. And so those patients who need those drugs IV-wise can't get access to them. So just talking about these things are important. It's good to stay positive and focused, but just kind of looking at how do we fix these deeper, issues during this time. So.
Well, know that I'm going to keep fighting in Congress. We're going to make sure that that we continue to press to get all the assistance that people need during this really difficult time.
Really appreciate
it. We know you are.
Thank you.
Yeah,
Thank
we're
you
thankful
so much.
for you being on our side always. and Tori, I love you. I met Tori. Tori had gotten one of our Tigerlily Hope bags when she was first diagnosed, and I had no idea who she was. I went to a Eli Lilly conference, a patient advocate conference, and I walk in there, and she's like, "Oh my God, I have your Hope bag," and the bag's about giving patients hope during breast cancer. So I love Tori, but my ending this is all saying that
I totally fangirled on you a little bit, but I still do.
I fangirl on you. But I want to end this with the feeling of hope. I know that it's very scary. We're all in this, WTF's happening, but I love that, Debbie, you are in this world, and Tori, you are too. We're the GSD committee of getting shit done. We're going to get this taken care of. We're going to survive and try to be out of COVID. And if you guys need support, contact me. I'm on social media everywhere. Contact Tori. Debbie's available as well.
Yeah.
And we'd love to have you guys. Oh, Julia's laughing. She's like, you're definitely the Get Shit Done caucus. We are.
I saw. Yeah.
We're getting comments on the sidebar.
I can see it.
Yeah.
Awesome.
Oh, I love you guys.
Bye, everyone.
Bye. Thank you for
Thank you
God
so
bless
much.
you both.
Love you,
Thanks for
Maimah.
having
Love
us,
you guys.
Love you
We're
too.
with you, Tori.
Talk to you soon.